hip-hop, rock and roll, all in one station, mixing genres and generations. You're listening to KNLY New Waverly, Texas, 91.1 FM, The Boss.
Programs presented are submitted by members of our community and are a proud sponsor of KNLY 91.1 FM. The views expressed do not necessarily reflect those of KNLY 91.1 FM, The Boss, and affiliates.
Welcome to Superhuman with Dr. V and Jason Phelps. I am Dr. Willie Villarreal, board certified family nurse practitioner, doctor of nursing practice, and owner at Core Sports Health in Conroe. This is basically at Conroe, we take a root cause functional medicine approach to help you achieve your optimal health and vitality. So you'll be seeing a commercial here pretty soon as one of our sponsors. So look forward to that. But if y'all have any questions or issues and would like to come see us, feel free to look us up at coresportshealth.com or call us at 936-441-2673. And with me always is Jason, buddy Jason Phelps, and he has him and his wife have TWC Prep, the kind of the go-to
That's right.
place for training and
Woodlands
nutrition.
Coaching and Prep, and we're here in the Woodlands. We've been here 10 years now, it seems like. Looking forward to this show today. We got a lot to talk about.
Yeah.
We got some great guests and people that we talk about all the time.
All the time. I think we mentioned them. Like I text Chase afterwards, and I said, "I think you need to watch the show." I said, "I think we mentioned you like 10 times last week," and you just put laugh out loud. But basically, I'm really happy to welcome both of us. We both know the Banks real well.
Yes,
two really long time friends. Dr. Chase Banks from Finish First here in the Woodlands, and his wife Vanessa. Chase is a sports chiropractor and expert, in my opinion, and a lot of other people's opinion, in sports performance, injury prevention, recovery, and literally one of the gurus that I know as far when it comes to like nutrition, and just integrative
being
health.
called a guru.
He is a guru. No, he is. Literally.
That's how you make him blush right there.
Yeah, he is literally. If he hasn't heard about it, or if I haven't heard about it, literally I'll text Chase. Have you heard?
Yep.
So we bounce a lot of stuff back and forth on each other, and then Vanessa herself is just we've known her for years and years, and expert in essential oils and a lot of other things now, home birthing and alternative birthing options, and that's kind of what we're here to talk about. So really we're going to start it off with kind of alternative birthing options, which is it really become popular for lots and lots of reasons. So welcome to the show. Look forward to asking y'all a lot of questions. So where would you like to start as far as like what has been y'all's experience, because I know y'all had a lot of experience with the home birthing situation, at y'all's house. So how did all that go? Like, just explain it.
Well, I would say, our first child, we did a traditional natural birth as much as we could in a hospital setting, because, I was just fresh out of school, starting my practice, and as you know, I practice very medical based, very scientific based. So going with the cultural theme of our healthcare system, that's the route we chose, and it's because it's really the only one we knew. There wasn't a lot of information at all at the time on alternative birthing methods. It was probably more scary to even think about it. And we went that route.
And also we were also at the fertility clinic when we got pregnant with Bailey. Like, by the grace of God, we got pregnant on our own, but we just stayed with our OBGYN. But it was kind of a traumatic situation, like my birth, and so I just knew that it was going to be that I wanted a different option going into once we got pregnant with Kennedy.
And then
once you knew that, then kind of what were some of the things you started looking into to make that?
I didn't have anybody to like guide me. Like right now, like I feel like there's so many people who do more natural births, more holistic living, but I felt like I just honestly prayed about it, and God just threw Nativity in front of my face. And so they are an accredited birth center, and I went there. They gave me a tour, and I told Chase, I was like, hey, this is what we're doing. And he's really not ever going to tell me no, because he knows once I get my mind made up, like, we're doing it no matter what, so
Life after life.
yeah. And so that's kind of like what happened was we went there, and our care was so different. Like, it was very hands-on. Every single time I went to go see them, it was 30 to 45 minutes that I was there with them in front of their face, asking them every question. They watched my diet. They monitored my weight. They monitored everything about me, and they knew who I was. Like, I wasn't just, and not to say that my OBGYN did not.
Well, and here's what we see, and I'll always, come, from the medical side with you. The thing about it is that because of the volume, patient volume,
Yes.
you just don't have the time. And for the important stuff, gestational diabetes, just because of our poor American diet, is on the rise.
Yeah.
I mean, and
Right.
so the problem is that you're not addressing, you don't have time to address the
Yeah.
diet, and I'm not saying that as an excuse. That's in
Yeah.
traditional medicine.
Right.
Don't have, in a 15-minute office visit, don't have the
I
time
know.
to go over that. We're different, like I said, in our office, just
Yeah.
like y'all are.
Yeah.
Because you have to put an emphasis on the diet and nutrition, especially
And they do.
pre and perinatally,
Yeah,
and
yeah.
that's what you get
Yes,
there. So it's-
100%. And they actually even have like outside people who can come in and help with nutrition as well. Like, they send a lot of people to Chase, and I know that a lot of the midwives will do that. They'll
there's a lot more.
Right.
All the vitamins in the world are not going to overcome
No, and a lot
poor
of
diet and a high sugar.
right. And a lot of the
intake.
ones that are being prescribed like by doctors have folic acid instead of having folate.
Folate.
And that right there is a huge like
Red flag.
yes, you
Red
know.
flag.
Mhm,
Yeah.
yeah.
Yeah, and you'll still have a lot of people that don't understand nutrition,
Right.
That still folic acid, folate are the same
Right.
thing, or methotetryl-hydrofolate.
Right.
It's different, very
Right.
different, very different. So, yeah, so that it's good that you at least y'all are getting that.
Yes.
That's
Yes, we got very, very blessed. Like, our first, like, out of the gate and being there, like, it was game changer for us.
So
you know,
Kennedy was the first one there.
she was the first one
So
there.
what about the
and then we
successor?
had Lindley there, and then we had Hartley at home. So our midwife from Nativity came to our house, and she brought a nurse with her. So it wasn't like she was just there by herself. She actually brought a nurse, so that way the nurse was there to monitor me as well. So it wasn't like she was just there by herself.
she
She
was-
could have been, but the nurse was there the whole entire time. So it was awesome.
Comforting.
Very,
Yeah.
very.
Yeah, basically, if Vanessa would possibly stall for a little while, or contractions would kind of slow down a little bit, it would give her time to just check fetal heart rate,
Yeah.
check positioning, things like that, and then we can make some positional adjustments. 'Cause
And
a
that's
big
one thing that they
It's-
do know about is
it's different.
positional.
Is the positional adjustments for getting the baby to progress.
Yes, yes.
And when you say positional adjustments, you mean so turning them on her side, for instance.
Turning her on the side, like we did like some stretches, we did some rebozo, we did where I would labor on the toilet facing this way just to open everything up. So that's one thing that midwives know is they know different positions, and they know like every woman when they're having their first baby, they're like, okay, like what can I do? I want to go right now. Like, this is my due date. This is when I want to go, and so they think, oh, I have a due date. That's when I'm supposed to have my baby. With midwives, they're like, your baby is going to come
When it's ready.
when it's ready. Like, those contractions are going to come when those lungs are fully developed. And that's exactly correct. And so it's like they know how to kind of hold you off. Like with Kennedy, she was actually 12 days late. And we went and we did a stress test. We did monitoring. And she was like, okay, Vanessa, it's about time. Like, we got to get her to come. And so we did some things. And that's when we got introduced to the oils. And we had her that day. Like, she just knew exactly what to do.
I was super anxious, obviously, because it was our first experience, and then I was always taught, once you get 40 and a half, 41 weeks, we were 16 days.
Oh, maybe it was 16 days. Yeah,
We were
she was 16.
days
Yeah.
post due.
Yeah.
And
Lindley was 12.
I'm like, okay, we got to get something going. And so when she's like, and we went in there for that visit, and we left, and she goes, okay, y'all can go get something after
And
she had
she's
done
like-
some, some specific techniques with her membranes and things like that. she goes, okay, y'all go get something to eat, and I'll be back here later this afternoon.
She's
We're
like,
gonna
I'll
have this
see you in
baby.
about
And
an
I'm like-
hour.
And I'm thinking, we've seen no progression. Sure enough,
And you want me to go eat before I have
Right.
the baby, right?
Well,
Okay,
and I didn't.
making
I
sure.
went. I like labored at the office because it was right down the street. I literally came back an hour later. I was like, "Okay, I think I'm ready." And she's like, "Okay." 17 minutes. My water broke right then. 17 minutes. There was Kennedy.
That's
like
incredible.
it was incredible.
Well, and I can tell you some simple techniques that most people don't even use, and we can attest to it, was even something as simple like the nipple stimulation. Like
Yeah.
Some people say, oh, it doesn't work. Well, you didn't do it right or long enough.
Right.
Because I can tell you, we just did it. I wasn't a believer. Not that I wasn't a believer, but I
Right.
just hadn't done it.
Right.
And I think with our third, with Sarah, with Emily,
Uh-huh.
with our last, we just did we were a little bit early, and we just did a little nipple stimulation. You got to do it like 5 minutes.
Yeah.
And at about 5 minutes, the actual oxytocin
Yeah.
release happened.
Yeah.
And she started going, ooh, ooh. I remember Kat saying, ooh. And I said, well, we're not ready yet. We stopped.
Right.
But she actually felt
Yeah, the contractions coming.
And so we held off until kind of closer to her due date. But because we kind of did it because we believed it in, and
It works.
It works.
There's
And
so much, like that's the whole thing,
Now, my big question, we talked about this right before the show. From the medical side, I see,
Yeah.
the not the bad, but the things that can happen. So,
Yeah.
for instance, the majority of, the surgeries I still do are C-sections.
Yeah.
I work with a lot of the OB-GYNs.
Yeah.
We did 2 C-sections yesterday specifically for fetal distress. Now, my big worry or big scare, and you can talk to this, is monitoring at home. Like, are they monitored? How well are they monitored? I understand, like, at nativity. Like,
Yeah, no, but at home.
Like, at home, the fetal heart monitoring, because both C-sections we did yesterday, they were for fetal distress. They were for
Yeah.
what we call deceleration.
Yeah.
Both of them had what we call nuchal cords.
Yeah.
So they both had nuchal cords, and it's actually a lot more common.
So Kennedy had.
People.
Yeah.
And so, what has been your experience as far as at home? Number one, the monitoring.
Yeah.
The emergency plan.
Yeah.
If something goes bad.
Yeah.
And then, the nuchal cord, because we see nuchal cords actually are upwards of 30% the
Yeah.
longer that they go
Yeah.
towards gestation. So at 40, 42 weeks,
Yeah.
it's upwards of like 30%. So like 1 in 3 will
Yeah.
have a nuchal cord. And
Yeah.
sometimes, depending on how loose it is,
Yeah.
they can cause hypoxia or asphyxia,
Yeah.
things like that. So what is...
Well, for our second one, I remember because as a father in a natural birth, you're right there in the midst of the action, right?
Yeah.
So I remember as she came out, and I could tell the cord, and I went to go try my, and I've never done it before. I've never done it before. And then our midwife goes, "No, let me handle it." She kind of smacks my hand, and she literally, with just a twist and a finger, and pulls it right off.
Oh, yeah,
And
yeah.
Where I tried to get my
Yeah.
finger in it,
Yeah.
and it felt like it got tighter,
Yeah.
because I didn't know what I was doing.
Yeah.
Yeah.
And so
That's an odd reaction. I
It
gotta
is.
tell you that I think something's wrong. I'm gonna stick my hand in there.
yeah.
Oh, he was like in it
I don't know
doing
if I
it.
would
Like
have
he's
that
like, here we go.
reaction.
I didn't even see it. Here I am, like I've just gone through, because birth is trauma. Like it really is. Like it's traumatic.
Well, I have
Especially.
another question in a minute,
Okay.
but I will get to it.
But what I was going to say is there is always a plan. Like I will tell you, like even being at a birth center or being at home, you do have to have a backup hospital. You just do. Like that's one thing that they're going to require you to do. They are going to, like when we were at home, we had to call our local fire station and just let them know that we were going to be having a home birth. So I mean, there is definitely
So that they
always
would have
backup.
everything that they needed on the bus if they needed to come to
Right.
the house.
as far as the monitoring, what kind of monitoring goes
So
on at
they
home?
are literally always checking the fetal heart rate, like within every 20 to 30 minutes, and especially as your contractions pick up, they want to make sure that everything is still going okay with the baby and still going okay with you. Like that's one thing. But I will tell you, with a natural birth, you get to be in the bathtub a lot. And I will say, if you're going to have a natural birth, be in the bathtub, because you are calm, you are relaxed, you can barely feel your contractions. Like, there was one point whenever I was pregnant with Lindley and I was having her in the bathtub, I was like, I got to get out of the tub. I don't think that I'm having contractions. She's like, oh, no, you are. And I was like, I just feel so relaxed. Like, but that's...
Lindley's was like a...
Lindley was like kumbaya. Like, it really was. But
So
it,
is there something you're adding to the water specifically?
no,
during
it's
that
just
time?
warm water. And so you're so relaxed in there that your body's just able to have those contractions and you're just not even focusing on them.
Alive,
You're
I guess.
so, yes, you are. So I've birthed 3 of them in the tub because it's...
Because it is, as you all know, if you and you guys have been around, getting the mama to relax as much as possible, let the contractions do the work. Mom tenses up,
Yes.
contractions fighting that tension within the nervous system and what it does to everything within the uterine, organ itself. So that's the problem is for, I think for our first one,
Oh gosh, it was awful.
we were so unaware really what we're doing. Obviously trying to have a baby as natural as we could at the hospital. It's, the tension is there. The timing of everything,
Yes.
to get it done. My parents were in from out of town
so
for just
awful.
a couple of days, so we're trying to hit that window.
Just that window, yeah.
So it was one of those things, and then being able to do it to where, all relaxed state,
Yeah.
that kind of stuff. It progresses a little bit.
My
easier.
midwife will literally tap my forehead. She's like, relax that, relax it. Because what happens is if you're tensing this, you're tensing everything else. So she'll be like, relax this.
Oh yeah, you can do it when you do a guided meditation.
Yes.
session. It'll sit there and say, relax your toes, and it'll say, relax your tongue, and you won't even know that you're
Pressing it against
you're
her
pressing
face.
against the
Yes.
roof, and then you're relaxing. You're like,
And then once you relax that, everything else just relaxes,
So as far as that, then the emergency, plan, all that
Yeah.
in effect. The other question I have is at home births, the big question is any medications at all? Are there any attempts at nothing like that?
No,
No?
honestly, like even at the birth center, they have oxygen. So they definitely have oxygen if you need it. But really, so for me, I just use essential oils the whole entire way through, especially with Lindley and Hartley, that was just what I used, and like I said, with Kennedy, that's actually when we got introduced to essential oils was at the birth center. She used them that day. She put clary sage and lavender.
What did they?
Clary sage and lavender on my belly. I was not having any contractions.
Okay.
Immediately started having contractions, and they kept on. And then I got really sick during transition, and she was like, "Oh, here's some peppermint," and I was like, "I
She
whipped
thought
that.
she was gonna
Oh,
throw up.
I
Hey,
was."
smell it. Don't put it on your eyes like my wife.
You definitely
She
do
was
not
very
want to do that. Or another thing is you can actually put it on a towel, and you can have that right there, so you can just smell it on the towel. So it's not on you, and you can just smell it on the towel. I will say Valor, you can put on you. That's one for courage. That's really, really good. You can diffuse. But yes, don't get it in your eye.
So she's gonna kill me. I'm sorry, babe. She's gonna kill me. But originally, I think I called you years and years ago.
Yeah.
I'm talking about
Yes.
6 years ago
Yeah.
when I got her the original kit.
Yes.
We were on our way on vacation to New Mexico. And I just had this headache. We're all in this
I
RV
remember this.
together. She's reading her book from her kit, right? And
Yep.
she goes, "Ooh, this is good for headaches." So
And
she
which it
pulls
is.
out the headache. She goes, "Here, put some of this on your temple." So she put it on, put some on, and I just kind of rubbed it on, and I just in 2 seconds went, "Ah!" And I started screaming. I was like,
Right.
"What did you give me? What did you give me?" And
Right.
she says, "Oh, it's supposed to be with the carrier oil. This, all this."
Well,
and she
it's
didn't
very
know.
cooling. It is. So peppermint's very cooling. So I would say, and also putting it on if it does get in your eyes, a lot of people are like, "Oh, let me put some water on it." Do not ever do that.
Yes.
Get a carrier oil and just put it on top of there because it's
So-
just going to keep burning.
Yeah, but what's funny is that even in surgery or other places, we use even alcohol. We'll tear an alcohol pad. and
Yeah.
you can smell it, or
Yeah.
peppermint, and
Yeah.
it'll help. So now Kat will actually put peppermint in the
Yes.
flame,
Yeah.
nausea, and you'll just smell
Yes.
it.
Immediately.
Immediately,
Yep.
nausea goes away.
Yeah. For sure.
So now those two. Now, what are they specifically for? Just relaxation, the lavender and the clary sage.
So the clary sage is actually once you are starting to have contractions, they help the contractions to continue to progress. And so that's one thing is people are like, okay, I want to have this baby, and I'm like, you can try clary sage, but it's really once those contractions start coming that it's really going to help
them in that stage.
keep them coming. And then lavender is just so very relaxing, and Valor is a blend that Young Living has, and it's just great for courage. So I had Chase just drop it down my back, or we were diffusing it. There's several other that you can use, but those are the three main ones that are just.
And what she did was just like a lot of moms do when they have a birth plan with their OB.
Oh, yeah.
Her birth plan was kind of a delivery plan.
Yeah.
And so there was different stages of obviously labor. And as the delivery happened, we had different oils we used.
Yep.
And even when the girls came out,
Yeah.
I would put oils on the girls.
We would anoint them.
And it's a traumatic experience for the baby as well.
Yeah.
And for everybody listening that thinks this is new age, who it's actually
not.
going back to
Yes, it is.
biblical use.
Exactly.
And so it's nothing new. It's just
It
kind of
isn't.
just like with diet, nutrition.
Yeah.
Everything we're having to return back.
Yeah, think about if we did eat
Yeah.
like that. Yes.
Yes.
Mm-hmm.
So now as far as that, from again from the medical side, you know, we just always worry and see, just because we see the bad side. You know, I see if I'm doing a C-section, a lot of times it's because there's fetal distress, or or dystocia. So like, what do they do in the case at nativity or at home for any kind of like head or like shoulder dystocia?
So what you have to think about, just what Chase was saying, is they know a lot of different ways to get that baby into a position. So you have to think about, we have round ligaments. And so one really good thing is they know how to help stretch those round ligaments. They know how to.
That's a big part of.
And chiropractic care is huge for them too.
Transitioning the mom for a natural birth.
Yes.
Because we'll have in our office, especially if they're with one of our local birth centers or one of our local midwives, they're coming in usually pretty much every 2 weeks in their last trimester, and then once they get pretty much at 36 weeks, every week, and then once they're at 40 weeks, it's twice a week. And then there's been times when a mom gets stuck in transition, and because we're so close to a couple of birthing centers, they'll come over and have either me or one of our other doctors, like Angela, that does a lot of our moms, and work on them a little bit. They'll go back, and it just progresses the contractions a little bit further. Getting that baby in position has a lot to do with what the shape of those hips and that pelvis is going to be in. And so, like you say, with the width of what the baby is, like going back to some of the positions, like, believe it or not, like, I know it seems crazy, but like handstands with like a scarf around her stomach, and it's like she's up against the bed with
like my knees down, like my knees on the bed, and my hands inversion.
It would be hard to say that you would see
say a handstand because I would die, but yes, inversion, I would say. But there, I mean, even like the Addis, one of my girlfriends, she was there and just was not progressing, and the midwife went with her to the hospital, stayed with her the whole entire time, actually still delivered the baby. But it had just been too long, so they went with her. So that's what I'm saying. Like, there's definitely care. Like, the midwives are there for the mom, area, not for themselves. So, you know,
our birth centers in this area, we're very fortunate,
top notch,
to have some of the best. And like, they understand. Like, look, at utmost, it's baby and mama. Yeah, their well care is the most versus just the experience alone, right? So, you know, they have that relationship. And I think, you know, like, for instance, I think St. Luke's is where...
I think that's where she went, too. But we have, like, each midwife kind of has, like, the hospital that they have that relationship with. So, I mean, they just have that. They always have a nurse, too, to back up also, you know. So it's like... The
reason I bring it up, though, is because, again, going back to the prenatal care, we're seeing, and Dr. Sullivan, I had a surgery with her this morning, and she brought up, she says, we're seeing an enormous amount of macrosomic babies now. In other words, very, very large babies. Just literally, if we go into the right position, they ain't coming out. Like, they come out with a major cone hit but again, why? Because they're gestational diabetes. Yeah. These are very large babies. But again, it goes back to their diet. Yeah, and so 100%. They're very, very, if they're not cared for properly prenatal, they're making these large macrosomic babies that aren't going to fit through the birth canal. Yeah. That's where we were in running into the problem. Now, do they kind of see that early on?
They do. I will tell you, like, so I felt like with Bailey, I never got questioned about my diet at all. I never got any,
y'all are outliers. Y'all are
you know, but I'm just saying, like, I guess he knew that, you know, but I guess, like, he already kind of knew, like, my craziness, especially whenever I got pregnant with Bailey. I was still, like, working out, like, hardcore. And so, but I will say that there was never, like, for nutrition, I never got that one-on-one for nutrition, but I did feel more confident and comfortable talking to them about nutrition, you know? And so I think that is huge. And I think that if people are going to, if they are going to be with an OBGYN, that they maybe do need to seek outside care as well, like especially for nutrition and stuff like that. And maybe we would see a change then if we could do that, you know?
So whenever a young mother decides that she wants to do a natural birth, you talked about having this birthing plan.
Yeah.
You know, how far along in that process do they need to start contacting the delivery centers and things like that? Start making plans of how is this going to go compared to a traditional hospital type?
So we were at the birth center at 8 weeks is when we went there. That's when they start seeing people, is at 8 weeks, because that's normally when a fetal heartbeat will be there. That's when viable pregnancy is usually there. And And so that's when we start to see them, and we see them every 4 weeks, and then as we get closer, every 2 weeks, and then it's every week. So we're seeing them just like you would a normal doctor. We're seeing them as much as that, but we are spending 30 minutes. Yes, every single time. Yes,
great.
yes. But like you said, it's not. They're not having to see for OBGYNs, they have to see people who are having female issues also. And so therefore, we get to see that we get the care that we really need. Yeah.
You wanna address
Yeah.
that?
No, that's fantastic. I was just seeing on our Facebook feed, and Ashley popped up and said, that was me.
Yes, I'm sorry, Ashley. That was her.
We didn't
saw
use
that
any
pop up there.
names.
I didn't use any names, but she does. She does know, and that's the whole thing. Is she is actually back with the Addis this time, having her baby there. You get such a comfort, that they have your best interest at heart, and so it's for us, it was God's plan for us to be able to do that, and that is why I am so vocal about if anybody wants or needs help to do that I am so willing to do that. I've actually had 2 really good friends who I was there to be able to help them deliver their babies, and was one of the first people to hold their babies and hand it off to them. And it's I would say that if you are going to do a natural birth, sometimes it's nice to get a doula as well, because that person is going to be the person who is going to be holding you up, who's going to help you to change the positions, who's, if your midwife has to run out for something like that, doula is going to be there to be with you. And so that's another service that I now offer, just because I know my midwives were so good to me like that. I want other moms to be able to have that experience as well,
And so with everything going on right now with COVID and everything else, this is a real viable option for a lot more
That's what I was
And
going to say.
That's what we're noticing with our local birth centers, is that they're getting a lot of late-term transfers, because people are concerned about the risk, and if they're low risk, and again, those individuals that have already pre-done a lot of things and have cross-checked everything with their OB-GYN, and it's usually not that big of a deal, but we're seeing a big uptick in it right now.
Yeah. Birth is meant to be beautiful. It's meant to be our bodies are designed to do that, and so if you get that in your head as a woman that you're not supposed to be under stress, you're not supposed to be feeling a certain way,
it's not a procedure.
Yeah,
right?
exactly. Yes, transition is a little hard, and yes, going through that, pushing that baby out is not the easiest thing. But it's what our bodies were made for. No matter what, any female can do it. It doesn't matter how strong you are. You are meant to do this, and so it's just giving women the freedom. And even if you are with a doctor and you just say to them, hey, this is how I want my birth to go. Mm-hmm. And if doctors just say, you know what, I will guide you in that because that is what you want, most of the time it will happen organically how it's supposed to. It's when mine told me, oh, you have a small pelvis, so you're probably going to end up having a C-section. I was like, pelvis schmelvis, nope, not going to happen, And thank God he went out of town, because never once did that doctor who came in, was he like, oh, you need to have, never, not one time did he tell me that.
He never mentioned anything.
No. And I was in labor for over 48 hours with Bailey, and I had to push for 3 hours. Holy cheese, it was awful. And he still let me have her, but I was on my back, and I just don't birth well on my back. My pelvis obviously is just not ready to birth on my back. But
we have it's been a great start to the show. I hate to cut away for break, but we're up to our first break from our sponsor, so we'll be back in about 2 minutes.
Yeah.
Hi everyone, this is Chef Laurent. I'm the owner of Taste of Paris, a catering company for seniors. If you want to know more about those services, give us a call at 832-415-7374 or visit our webpage at laurentvalsculinary.com. Thank you.
This was a proud sponsor of KNLY 91.1 FM. It's time to change. If you like country, we play it. If you like pop, we play it. If you like Latin music, we play it. If you like rock and roll, we play it. Because no one does fusion music like we do. 91.1 FM, The Boss.
Turn on your glam today. The Jenna Klein collection is here, elaborated with natural products. Give yourself a compliment with our organic lip glosses in more than 15 shades. With the Jenna Klein lip gloss collection, you can hydrate your lips and keep that glamorous look that you need. Turn on your glam. Visit jennaklein.com. And don't forget our skincare collection with natural ingredients that will improve the skin's appearance and prevent visible signs of aging. We have everything you need to achieve smooth and vitalized skin. jennaklein.com. Turn on your glam today.
This was a proud sponsor of KNLY 91.1 FM.
Hi, everybody. Welcome back to Superhuman with Dr. V and Jason Phelps. We're here talking with Dr. Chase Banks and Vanessa Banks. We had a good first start to the show with home births and midwife versus OB-GYN, and a lot of my questions got answered because, again, being from the medical side, I see the opposite. I only see the thing, and my other question, and I was going to ask you this was, where do they stand as far as Nativity or Addis or any of the other ones?
Yeah.
As far as what we call VBACs, because there's a lot of, and VBACs for people that don't, they're vaginal births after C-sections.
Not a lot of virginal births going on.
No, I hope not.
Definitely not.
No.
Pretty rare.
Vaginal birth after C-sections.
Mm-hmm.
So what those are, there's a lot of, they're very risky, okay, because just on their own.
Yeah.
Just on their own, just simply because of the incision that we make into the uterus during C-sections. There's a lot of OB-GYNs that won't do them, or that will only do them if they're in the hospital when they go into labor, because the time for something to go from fine to really, really bad is very, very quick if there's a uterine rupture. Now, where do they stand as far as VBACs? Do they is it person to person? Is it individual?
It definitely is. So they have to know why that woman had a C-section in the first place. Like, what was it that made that woman have a C-section? Was it emergency? Like, was it something, or was it just that an elective? They just were like, oh, I want to have a C-section, and now they want a different option, or was it that, the baby wasn't progressing and it was their first birth, and so the baby wasn't progressing, but they hadn't tried all these other things. So they were like, okay, now we're going to try some things that maybe now the baby's going to progress. So it is patient to patient. And I will say that with Nativity being accredited, they will do VBACs, but I will say that some midwives will not. They will not.
It's pretty rare.
To me, it's very, very scary.
Yeah.
Because just for instance, yesterday, again, seeing it firsthand, the second C-section we did yesterday was we did it for a uterine window.
Yeah.
So literally, when we got to the uterus, there was one cell, literally, you could see it was just barely a tiny little slit, and we were into the uterus. I mean, it was just
that's scary.
And he even told us probably not a good idea to have any more births.
Did she bleed after that a lot?
No, it's not.
Okay.
But it's just the uterine wall is very thin. And since you can't see that until you actually get in,
Right.
that's very scary to do a VBAC afterwards. And the only reason I bring it up is I have heard recently there's one, and I don't know if she has the correct info, and I hope they guide her in the right way. It's someone that my wife knows, and basically she just said that she's thinking of having a home birth now, and she's had a C-section before, one or two C-sections, now her third one, and so I'm like, I wouldn't advise that. She says, I personally medically wouldn't advise it just because of the risk. But again, that's a very different scenario than yours.
Very different.
And in medicine or health and wellness, everything has to be individualized.
Yeah. But I do know a lot of women who have actually had VBACs, even in the hospital, that their doctor was willing to do it, and they knew.
And they'll sit there. The better ones will actually. The problem with it is that they'll not the problem with it, but the issue with it is that they will sit there and be there in house instead of being at home on call. Hey, call me
But
when
that's
it's ready.
excellent. I mean, I think that's what they should be doing.
Right.
Yeah.
But so I think that that's excellent that they'll be there and monitoring that. You know, I mean, I feel like that is good.
So what are some other like issues that mothers might have that
I'm going to
would
tell
need
you
be addressed there?
one issue is postpartum. Like if we're going to talk about birth, we're going to have to talk
Perfect
about
segue. Because
postpartum.
that was our next
Okay,
question.
because I will tell you that women go through different phases of postpartum. Like you have your baby, you birth that placenta, you're going to go through one phase of postpartum right there. At about 4 months, you're hitting another phase of postpartum. And women don't know this. We are all worried about the baby. How's the baby? What? Oh my gosh, you have this new baby. That poor woman has literally went from her highest point of hormones to her lowest point of hormones, where you're just like, and then you hand her a baby and you're like, here you go. And breastfeed too. You have to make sure you're breastfeeding, you know,
Especially
like
if it's the first time.
yeah, like I'm telling you, there's so much. Like I sat on the couch with Bailey for about, I'm going to say 8 weeks, like would not move. He would go to work and come home at like 9 o'clock and he would be like, did you get up today? And I'm like, I did not. I have not eaten. I did not get up. And this was like, I knew nobody. Nobody had babies yet. Like I couldn't call anybody. So I would just sit there and feed her all day long. And he's like, did you put her down? I was like, she cried. You know, so it's like, and then like once you start your cycle back, you go through another phase of like, once you wean them, you're going through another phase, you know, so it's like.
It's not just going to be a one moment in time if it's going to happen. There's going to be levels and degrees, and I see this with patients that come in, you know, that are trying to get their bodies back, you know, getting back into training, and they're not breastfeeding anymore, or breastfeeding didn't work out, or whatever it might be, and then we've got to address some of these, you know, emotional, you know, situations that are tied to the hormones that have become so depleted.
So what are the main factors in that? How do you start with that type of therapy?
So immediately you have to make sure that you're getting your needs too. So you're making sure that you're still taking your prenatals. You're making sure that you're still taking your B vitamins, that you are still drinking enough water. I actually used for myself, like after, because we were already using oils, like Bailey, I knew nothing. So I just like sat there and just like knew nothing. With Kennedy, we already started using oils. So I used oils with her. And then with Lindley and Hartley, I felt real confident with like the oils. And so like I used an oil called Grounding. I would use an oil called like Joy. Joy was my savior. Like it just kind of put me into very like, I guess like more of just a homeostasis where I just felt a little bit more. Also taking that time for yourself. So a lot of women think, okay, I've just had this baby. I've got to get back into shape. I got to do this. Like you actually need that extra like fat in order to make that good breast milk. And it's like you will have the rest of your life to lose that weight. Get that baby that good milk. And if you are not feeling like you are like having the letdown or whatever, get with a lactation consultant. I will tell anybody and everyone, breastfeeding is not the easiest, but it can be once you know exactly how to do it. You know, like, so I would say like,
so if you're struggling, reach out to
you have to reach out. Like you have to reach out. And honestly, anybody, any woman, if you are struggling with postpartum, please reach out to me. I will help you as much as I can.
I'll say the spouse or partner or just whatever network of team atmosphere they have, everybody has to communicate.
Yes.
I see so many times that moms try to be superwoman.
Yes.
And you know, I've seen her do it, and I've seen her go through it, and being able to talk it out and just address again what those needs are, how you're feeling, and then you know it's like, okay, well, as a dad, if you don't know anything medically, you're like, well, what do I do? Well, either get her to talk to someone, find a specialist that can help her, find a friend network, a family network, whatever it might be, so that you can get some support. Yeah. To not, because it is a kind of an unspoken. And sometimes, especially once it happens later on, like in that, you know, that the baby's already a year and a half old, because it can happen 2 years in, that they'll slap an antidepressant on it.
Yeah, because they just think they're not still considering that postpartum. When it could be that mom could have just finished breastfeeding and now her hormones are dipping again. So that's what happened to me. Like I quit breastfeeding, my hormones dipped again. We did the Dutch test. Come to find out, like my estrogen was so dominant, not because of the toxic products that I was using. So it wasn't xenoestrogens. It was literally my progesterone and my testosterone could not rise enough to get my estrogen to lower. And so I just added in Progestins Plus, which is the oil from Young Living, and then we added in Power Gize, and then a couple of supplements from Designs for Health.
Like
and I'm
Dem,
gonna,
the Dem,
yeah, and I will tell you,
gosh.
I'm a night and day different person. Like, I was so snippy and snappy, and I just felt like the weight of the world was on me. And then it was like, but just think about when you have that much estrogen and you have no progesterone or testosterone. So where's your energy coming from? Like, my energy was literally coming from caffeine, you know, because that's what I was trying to get through the day, you
You're
know.
not going to be able to care for your baby the way you want to.
Or
The
all
way
your
you
children, or your children, you know, like you're just not. Like, if you don't focus on those needs, but there are so many things, like I said, Progestins Plus. Like, you can start Progestins Plus while you're breastfeeding. Like, it's not something that is going to, it's just a natural progesterone, and so it's not going to hinder your breast milk. It actually may help it because you're leveling out those hormones. You're going to be less stressed, and so therefore you're going to be able to produce more because you're not as stressed, you know? So, yeah.
Shoot, that's great. So what about for the baby? I'm going to get into
Okay.
your wheelhouse a little bit here. What kind of services do you offer for the babies? Which I just found out about this last night. I didn't know this was actually really a thing.
Yes.
So, you know, we have so many moms that come to us that you know, with their kids having gastrointestinal problems.
Yeah.
Maybe it's
Ear
a lot
issues.
of skin issues,
Yeah.
earaches, things like that. And I will tell, you know, again, I'm a way different type of chiropractor than most. And if it's not heavily validated through research, you're not going to hear me kind of making a claim on it. But
Right.
and that's what goes with the adjusting process too, just as a chiropractor. The adjusting is afferentating the nervous system, meaning that we're providing a stimulus of sensory into the spinal column. What happens after that is very hard to really register the effectiveness of what is going to be person to person. There's a lot of extenuating circumstances. Nutrition plays a huge role.
Yes.
The sleep cycles of a child and parents and the systems in place to harbor that plays a huge role. And so with kids, I mean, I have some parents go all the way into basically wanting to find out what's going on genetically with them from an epigenetic standpoint.
Yeah.
What are the SNPs of DNA that could be causing some of the pre-signs of something that can come on, whether it's a behavioral issue that might happen once they're developed as a you know, an adolescent, or whether it is some of those inflammatory things that can cause some of the chronic skin issues or digestive issues and things like that, and then we can address it through nutrition with the family and or the parents. And that's a big thing, is that when I have a child that comes in that does have some, you know, let's say pre-autoimmune tendencies or something like that, then the family's got to get on board.
Yeah.
You take a child, especially when they're very, very young, especially if it's a female, if they get into their adolescent teen stage, is if the whole family isn't making a lifestyle shift,
They're not going to.
the child's not, and the child's going to feel ostracized and going to feel psychologically a lot different because there's something, they've got an issue.
Yeah.
So that's the biggest thing that I can push for parents if they have children with some health issues and things like that are managed through lifestyle changes and nutrition, is that everybody has to supply that support.
Yeah.
But I mean, as far as what we do in the office, like I said, just like your office and stuff like that, it's all case by case basis. Certainly there's things that you'd be surprised that come through my office that we have to send out to Texas Children's, or we have to send it down to MD Anderson because it got slipped through the cracks because it wasn't textbook symptoms,
Right.
especially for a child or somebody hasn't listened to their mom and dad as much.
Right.
So
Yeah.
45. Yeah. So this is a perfect time for our last break. We'll take a 2-minute break from our sponsors. We'll be back in just a second.
Yeah, but he also.
Hello, my name is Dr. Sadaf Javed. I'm a child and adolescent psychiatrist and I see adults also. I've been practicing in the greater Houston area for the past 5 years and my practice is in the west side of town. In these unprecedented times, it is so important to check in with your mental health. Please pick up the phone and call 832-304-7244 or mycognitivepsychiatry.com and we would be happy to help. Thank you.
This was a proud sponsor of KNLY 91.1 FM. We are broadcasting live from the Woodlands, Texas to the world. You're listening to the only multimedia FM station in Houston, Texas. Your Fusion Radio. Top 40s, dance, Latin, country, pop, rock and roll. All in one station. Mixing genres and generations. You're listening to KNLY New Waverly, Texas. 91.1 FM, The Boss.
It started as a dream. When I was a little kid, I always wanted to have my own restaurant. And it was a dream that finally we had the opportunity to build it here in the Woodlands. And I'm so happy with it.
It's a really authentic Italian food. I try to maintain the most original possible. It's very important. Every day I make my fresh pasta.
Chi mangia bene, mangia italiano. Please come and visit us.
This was a proud sponsor of KNLY 91.1 FM.
And we're back. We're just going to keep moving forward with what we were talking about as far as the supplementation, the postpartum supplementation. We had some interesting, conversation in the break. So we'll just move forward with that. Now, as far as like you were talking, you were going to piggyback on what Chase was saying as far as.
So I was just going to say, I know that we're having a conversation that could be kind of foreign to people, and it is really hard to be like, okay, so you're going to get chiropractic care, you're going to get nutrition care, you're going to make sure that you're doing everything right. Mm-hmm. That's really hard, honestly. Like, that's basically a foreign concept to a lot of people. And so start slow. Just start with one thing, just know that, like, if you want to get the endocrine disruptors out of your house, start looking up those things, because that is going to help with ADHD. It's going to help with ADD. It's going to help with any kind of like asthma and stuff like that, so skin issues that he was talking about, sleep disorders. Like, I see so many people saying, oh, my kid has ADHD or has this.
Manage your screen time, not only for
Yeah.
yourself or your kids.
Yeah.
I mean, start with simple things that are actions that really take no thought whatsoever.
Right.
Everything is intertwined, and we talked about this.
It is.
Screen time is way, 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 way up. I mean,
Yeah.
you go to any restaurant, anywhere, and it's basically a kid has a phone or a computer or a pad.
Yeah.
And we think, oh, well, here, it's keeping them quiet and they're controlling it.
Yeah.
But the problem is, what people don't understand is there's a great book that Dr. Mark Hyman put out called The Food Fix, and it talks about how all the companies now, Big Food is Coca-Cola, PepsiCo, Nestle, but everybody is basically doing what's called stealth marketing
Yeah.
through these screen times, and they'll be just little pop-up ads. And so what they're doing is they're getting brand recognition
Yes.
and branding these kids'
Yeah.
minds with Coca-Cola, with every 2-year-old knows a McDonald's symbol, or and what it is as parents, we're being able to not compete for that sugar that they're or that marketing,
Yeah.
because they're saying upwards of 6,000 plus ads a year versus as parents we're maybe telling them twice a day or 3 times a day, hey, don't eat sugar, things like that. So, but again, we need to do better as parents to not. But again, we need to get over the stigma that people are like, "What? You're depriving your kid of?"
But
this?"
that's what I was going to say.
But it leads to the ADD
Yes.
and ADHD,
Yes.
and
Yes.
then they go slap them on Adderall. And,
That's what I'm
I mean,
saying. Like, you have to get over that whole stigma that you're doing something wrong if you're not giving your kids dessert every single day.
You are kids.
Or that they are. And
Right.
and you have to, like, make sure that you're not, like, because your kids don't get to eat what everybody gets to eat, and that you pack their lunches and stuff like that. Like, your parent choice for everything. Like, I am 100% on parent choice. Whatever you want to do with your kids, I am all for it. But I will say, for our family, that is one thing that they know that it's not, we're just not going to bring it in
and
our
it's not
house.
that we're weirdos, and
No.
there's data behind it. In
There
other
is.
words, like, if you're giving your kid FD&C yellow number 5 and
It's
blue
awful.
number this and blue, like, there's
Artificial dyes
a lot
are
of
the
data
devil. Like, they
on
are.
what they do for ADD and ADHD for children. It's
Yeah.
not even does it.
It does.
And it's not that they are even clinically
sugar.
diagnosing them as this. It is literally, they're not saying, hey, let's make some small changes in your kids' diets. Let's make some small changes in what you're bathing them with, what you're putting on them. Let's make those small changes first.
As I was preparing last night for this show, and I was kind of, I literally was watching, I wasn't watching TV, I was doing this, but on the TV it popped up, and it says what they're doing is it popped up, and it showed part of a healthy breakfast, and it showed Fruit Loops, Pop-Tarts, it showed all the things, but basically what they're doing is like, now we're starting this exercise program for
whole
the
grains.
Fortified whole, or they're Heart Healthy by the American Heart Association. I'm like, yeah, they paid $300,000 to get that label so that they can save their heart. But Fruit Loops in no way, shape, or form, no cereals.
Right.
I've heard people say you're as well off eating the cardboard box it came in.
I mean, honestly, if you may be better, but I will say it's the same thing with greenwashing. I mean, we are greenwashed all the time. Think about method. They're a 9 on EWG, but they're like, no, this is great.
So EWG, for people to know, it's called the Earth World Group.
The Environmental Working.
Environmental Working Group, and basically they score and procure a lot of the things.
Yeah.
It's called the EWG.
Yeah, and it's a good site to go to kind of.
It is a good program, but they can also be manipulated.
They can be. So I will say, that's where I read every label no matter what. I'm a label reader. I had horrible hormones growing up. That's why we were at the fertility clinic. I had endometriosis and polycystic. So you're talking about women who go through that. That was my story. But it was because of what I was putting in me, on me, and around me. And that's how, and I had gone to so many health doctors and nobody could help me.
Well, half the time they don't believe in it. They're crazy or a little bit.
Chase was like, I started doing so much research, and he was like, I started changing things. And he's like, okay, so this is what we're going to do. And honestly, whenever I brought the essential oils into our home, he's like, okay, babe, I understand the constituents, but how is this actually going? Our kids have never been on an antibiotic. They've never had any kind of medication. We use it for everything.
It's not to say that
I'm replacing, but I keep their immune system so healthy. Yeah. That's what it is. It's not replacing.
It's a homeostasis, kind of I would say, tool.
Yes.
To maintain that level of
wellness
within yourself.
Yeah.
And that's just part of, like she said, is well, if you're doing all these things, where do you even start? It's we started with years ago, 12 years ago, with little things.
And that was what it's literally one change a month. If you can make one change a month, that's when you're going to see in a couple of years from now, you're going to make such great leaps, And I've been able to witness families and moms do this, where they went from living a very, very high tox life to now a very low tox life. Because you're never going to be toxic free. You're just not. You walk outside and you're automatically going to get toxins, So,
but you can do your best.
You can definitely do your best.
And as a parent, I've got a 12-year-old and a 7-year-old.
Yep.
Is it too late for me to start that?
No, absolutely not.
It's not too late, right?
It's never too late. You can be my mom is 70 years old, and she started with me 6 years ago with head-to-toe eczema all over her body. And literally within, 4 months, things had just changed just because of the supplements that we had done for her, the oils that we had done for her.
Changing her. And just her hygiene products.
Yes.
And things like that. Slowly. It was, you can imagine someone in their 60s, the ability to make drastic changes is not going to be as easy.
They've got brand loyalty that they've developed for a very long time.
But she listened to us, and I'm going to tell you, Marianne is rocking. My dad.
Marianne.
You know my dad. Think about his whole thing, and he is so religious on his supplements that he's been able to keep a lot of things at bay that most people would have to go see an oncologist for.
So this is the difference in going to your PCP versus going to see somebody
who's going to be able to,
that's going to spend that time.
And there's still a place. There's still a place. But what I do see, I have a great PCP that he's my medical director, and he's super knowledgeable.
Yeah.
But as far as PCP, you're talking about sick care. So you're talking about what we need for So there's always a place for medicine.
Right.
For acute care, but the problem is that we're mixing acute medical care and chronic medical care, and almost everything nowadays is a chronic condition.
Right.
Okay, so we can't treat an acute problem with a chronic problem with an acute approach.
Yeah.
So it's kind of, and what I mean by that is they come in, high blood pressure, here's a blood pressure.
Yeah.
And no change to the
no
diet.
No long-term plan we're going to do this so that we can get you back to a safe realm. So it gives you time
Yeah.
to make those lifestyle
And there is a
changes.
place. There is a
Yes.
place. So sometimes if somebody comes and see me and they're 180 over 100 in this, and I mean, in the temporary, we may have to give a blood pressure med, and that's fine.
Yeah.
But with the goal
Yes.
of getting to the root
Yes.
of it and then
Yes.
getting off that,
Yes.
if possible. And in the overwhelming majority of people, it is possible. It's just figuring out. I mean, you can't give them a blood pressure med and then they continue to eat fast food every day.
Right.
Or cook at home and eat. So if you look at even the children's,
Yeah.
because we're about kids, the majority of the diet is cereal and orange juice in the morning, and a sandwich at lunch and chips.
Yeah.
And that's what we see. We just feel
Very
normal.
micronutrient.
So even for a mom like that who is so used to eating like that, so then they're like, okay, so what do I feed my kids? So that's when you start looking for healthier alternatives of those things. Like if your kid is already like adjusted to eating those things, then you say, okay, I'm going to look for a sugar that is lower in sugar, that is maybe a gluten-free cereal, that I am going to put almond milk in it instead of dairy milk. For lunch, instead of doing, I'm going to do a sandwich, maybe I'll do where I do like some roll-ups, so like you're doing roll-ups instead of like always using the bread, So you always kind of help somebody look for other alternatives of what their kids are already used to.
And they're out there because
There
there's
are,
alternatives
yeah.
now
You bet.
for everything.
I mean, there's everything that is dairy-free. Whatever you eat dairy, there is a dairy-free option, and that is probably one of the really great places to start is gluten and dairy. Like if you take those two things out, I mean, your body just starts to do what it's supposed to do. You'll notice digestive systems of kids like who do dairy. It's not good.
Well, a lot of sinus infection, a lot of
Yeah,
infections,
it's so much
a lot of-
inflammation. Like we're not supposed to have that. And so like if you take that one thing out, all those skin issues, all those sinus issues, you
And
may
why?
start.
Skin is a direct reflection of what?
Oh,
Yes,
for
yes,
sure.
yes.
Like it has to come out some way,
Yeah. And just by making those two quick changes,
Yep.
now you're reading labels. Now you're
100%.
paying more attention to what your kid's
Yep.
taking in and
Yes.
what you're taking in.
Yes.
And you're going to make better decisions
Yep.
than on Friday night we're getting Domino's.
Right.
Because it's easy and we need something quick. Instead,
Right.
you start thinking, well, that's not kind of part of what we're doing. Let's find something that's
Yeah.
a better option.
And you know what's really fun is making pizza as a family.
Yeah.
Like you can even do like a gluten-free crust, a cauliflower crust, like then you get to choose like what you're putting on your pizza, and then you're also doing it as a family. And I know that is not always like right now I'm in Corona time where I'm just like at home 24/7. So I'm like, let's figure out anything that we
Let's
could
get
do
crafty.
together. Let's get real crafty. And I'm not crafty at all. But it's like normally not in Corona time. You are always very busy. And that is like our first thing is to grab and go, grab and go, grab and go. But if we start to train our mind now, when we are at home, those become habits. And so then you're just going to continue to do them,
I really, 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 really hate to be the bearer of bad news.
No.
But we're
Our
out
time
of
is up.
time. We need to have y'all back for sure.
Well, this is awesome. Thank you so
I want
much.
to give us enough time to basically, tell everybody where to find y'all. So, where would they find you at 51st?
So we're in the front of the Woodlands. We're just off of Oak Ridge Drive. There's 26406 Oak Ridge Drive. We're Suite 101. But we've been in the Woodlands now going on 12 years, 11 years.
Yeah.
11. Just finished our 11th year. So
Yeah.
we're going on 12 years. We're going on 12 years in August. So
Well, we'll have Chase and Vanessa back on like pretty regularly, I hope.
Well, we thank you for letting us
to talk
come.
about a lot of other topics. And where can they find you, Jason?
They can find me at Legacy Barbell these days.
Well,
Oh, good.
Yeah, that's
they've
I'm
made
over there
their
with
big
them.
upgrades too.
Yeah, they have, and I'm taking advantage of that. And I'm also doing in-home training now too. So for those of you who do not
That's so
currently
good.
want to go
Yeah.
to a gym,
That's awesome.
or maybe don't want to wear a mask to a gym.
Yeah.
I know Legacy doesn't do masks, but other places do. If you'd rather just have me come into your home, contact me on Instagram, Facebook, wherever, and we'll set that up.
Okay. And you can find me at coresportshealth.com, and we will catch y'all next week. Thanks for tuning in.